useful. It is very useful along with localizing symptoms. And the parents are to be oriented to avoid antibiotics misuse during fevers, as because they, in simple fevers, if they get overdumped with the anxiety of parents or other family members, usually this can also leads to antibiotic resistance. So what I would like to conclude from the introduction part is the proper history taking. And in cases of a fever, we don't just highlight about the fever, but also how the child is presenting is the most important characteristic thing we need to catch up before treating a fever. The next cases which I'll be presenting two cases with an example related to my topic. In these two cases, the child is brought after using paracetamol. Case 1, this case is taken in August around 5 p.m. It's a male patient of 2 years 5 months old. He presented with a high grade fever of 101 to 102 degrees Fahrenheit, and usually that used to subside within 5 to 6 hours after use of antipyretics. And again, there is a relapse of fever. So after 3 days, they approached me, the homeopath. He had a dry cough along with fever. When I looked for the cause, nothing I could find out, and there is no aggravating factor or ameliorating factor. Amelioration is only through antipyretics, that is for a short duration. The concomitant which I got was he was absolutely dull during fever, and there was need for mother all the time during febrile phase. And there was clinging plus 3, loss of appetite was there, and thirst was reduced. When this case approached me, this was actually taken on a phone, and the picture which is on the screen, after taking the history, one thing which stuck me is the way the child was absolutely dull and clinging to the mother. This was the characteristic key point for me to arrive at a remedy. I got all the history was like we look for the characteristic symptoms, but most key point which helps us to arrive at a remedy is the presentation of the patient. Especially in pediatric cases, we give more importance to observations which we see in a child. So the picture which is on the right side, and this picture struck me, and as usual I made a totality repertorization, but the presentation of the child helped me to pick up a remedy. The remedy which I've prescribed in this case was pulsatilla, and I have advised it for 4 hourly and advised to stop all the antipyretics and to monitor temperature every 2 hourly. I've advised to hydrate him well. They have approached me on day 3. I have advised for an investigations. I thought of observing for like few more doses and then go for a blood investigation. So fever profile was mentioned as SOS. Later, after the medicine, around 5 p.m., the first dose was given, around approximately 5 p.m. Next day, he was febrile since last night, and the clinging, dullness, everything has come down. And the cough was SQ. The distress of the patient has come down, and I'll show a video. So, this was the child after our remedy. So, only few doses of pulsatilla. It helped him for the overall improvement of the patient and not just the fever. So next day, usually after an acute episode, usually we conclude it by giving a constitutional remedy so that the relapse of the acutes will become less. So subsequently, after like around 24 hours, constitutional remedy was given to prevent the relapse or occurrence of such illnesses. The next case, it's a case of a female who was 5-year-old, and it's a case of high grade fever, and parents used antipyretics for the first 2 days. and they got the investigations done, prescribed by the one of the allopathic doctor, and it stated that the child was tested typhoid positive. So in this case, the parents approached saying that an allopathic physician advised them for a hospital stay, which parents denied it because they felt the child is absolutely active, that too during ephemeral period, not during fever period. So parents thought that the child is absolutely normal and it's a normal fever, there's nothing to worry or hospitalize. So they have approached me whether we can help with our medicines. So I was very cautious because 5-year-old typhoid was positive, WBC count was very less, and they thought that the child is very active. But only they have their more concern is not to hospitalize the child, because they were so anxious that if the child gets admitted, they'll take multiple blood samples and all. So they wanted to be treated at home based. So the child was absolutely normal during ephemeral period, but during fever state, what they have mentioned is extreme irritability with weakness, and during heat stage there is perspiration over scalp. These are the characteristic things which I got in this case. And mother constantly, she was saying, she was so anxious, she was constantly asking me to whether to give homeopathy or allopathy or hospitalization. That was her state. And what it was done, like I have prescribed a remedy basing on whatever the characteristic or got. Like the mother constantly mentioned during ephemeral period the child is absolutely normal, but whereas in febrile state she was extreme irritable and nobody could handle her. So this was the major key entry point for me to get into this case. So the parents refused hospital stay as advised by the treating allopathic doctor because the child looked and behaved absolutely normal during an ephemeral state. So this was the totality I made with the key entry point and the key observation. Chamomilla was selected, and there was one line which was mentioned in Fatak Materia Medica that mental and physical symptoms appear in paroxysms like irritability, restlessness, and colic. So this was the state in a child. So 204 hourly was prescribed, and gradually the fever has come down within 24 hours, and the irritability has reduced, and the overall improvement of the child was seen. Through these two cases, I would like to mention, as a homeopaths, we take case taking in a very depth. But whereas it coming to pediatrics, we actually need to be very careful tracing out the very key points through observations. So that will lead to pick up an individualizing symptoms and then selecting a right remedy. So in case of pediatrics, observations play a key role to unlock the case. So my so we all as a homeopaths, usually we try to restore the entire health, whereas in pediatric it's very tough to trace the picture because we need to handle both the anxieties of parents as well as the other family members also. In most of the cases they usually give, as I mentioned, they usually give antipyretics and come back to us and saying that in spite of antipyretics they are not getting relieved. But the thing is, they don't give a proper dosage. When a child is at 5-year old, they give some antipyretic of some other dose, and when 6 also, when they give the same dose, but the dosage depends, as the dosage depends upon the weight of the child, the relapse of the fever is quite expected to come. So because of the lack of knowledge or their anxiety, uh, usually the children are dumped with so much of antipyretics and antibiotics, which leads to antibiotic misuse and resistance. So I would say, like, the key observations in the cases, especially in pediatric, through observations is the best to unlock the cases. So the right observation will lead to a holistic cure. So this I would like to conclude with my presentation.
Thank you. Thank you. Well done, Dr. Shivani. I appreciate your presentation. As I'm also dealing with the pediatrics, so you rightly said that anxiety of the parents is a very important thing to be handled. And I have seen in my practice many of my students and juniors, what they do is when mother is an arsenic mother, she'll come and call again and again. And due to lack of knowledge and lack of confidence on your prescription, sometimes you yourself mess up the case by giving the remedies or changing the remedy, so that further it causes complication and complex disease, and that a simple acute which could have been evolved with the simple few repetitions and the right remedy, that gets complex and then the patient spoils. So that's a very good approach, I appreciate. So now I would thank you very much, and please stay so that if there is any question answer session, if there is a question for you, you can answer. Now, I would
Sure,
like
sir.
to welcome our speaker, Dr. Hiralal Jain, sir. Sir, welcome. You can unmute yourself. I'll make you the co-host so that you can share your presentation. And
Good
in the
morning, sir. Am
meantime,
I
I again welcome Dr. KSS Sivamurthy, sir, uh, Dr. Thape, sir, Dr. Geeta Mongia, ma'am, who is chairman, Women's Cell, and Dr. Hiralal sir, Dr. Hussain sir. So all these dignitaries are here on in present in the meeting. So I welcome Dr. Hiralal Jain sir. Needs no introduction. He's practicing in Kolhapur. He has many cases. He has been a part of IIHP presentations and seminars. So we are proud of you right now. He is abroad. So his time zone was different. So we have adjusted the time of meeting accordingly. So sir, your stage now, your topic. Welcome, sir.
Thank you, Dr. Muktinder Singh ji. Uh, I am also very much good evening to all our Indian delegates, as well as my Indian friends and my Indian supporters and my Indian IHP members. It has been always a good time to share experiences on this IHP platform. Today also, I am thankful to IHP for giving me this platform to share my experiences, especially in this management of anal crucial hypertrophy cases. I think the slides are clear.
Slides are visible.
Muktind,
You're quite audible. Kindly proceed.
okay, okay. So as Shivani had given a very good cases before, they were quite good, and the way she managed those cases were quite okay. This is the basic that every homeopath should know. And especially the young generation of homeopaths that are coming, they should understand, or they should pick up this this way of understanding the case and moving inside the case. So here today we start with anal crucial hypertrophy, which is generally known as piles in very simple language. A very common problem. It is where homeopathy can prove its efficacy. It can show the amount of fast relief, not only immediate but also permanent relief that we can give for such patients. That is what I say, ki in homeopathy, around 60 to 80% of cases can be well tackled with homeopathy. This is one of the area where homeopathy has a very strong role of managing these cases very effectively. Effective management can be done with homeopathy in hemorrhoids. So, what is that? A short, small uh, introduction to hemorrhoids. It is basically a constitutional problem. It is, though it is seen as a local problem, it is basically a constitutional problem wherein the liver or the circulatory system is at difficulty. There is stagnation, and because of the stagnation, constipation, and because of the constipation, there is a lot of formation of piles as well as swollen and enlargement which is there. These cushions being swollen, enlarged, and can cause discomfort, itching, pain, bleeding during bowel movements. Anal cushion hypertrophy mainly occurs due to supportive tissue deterioration. Therefore, it can be in old age, long-standing constipation. Childbirth is one of the cause where there is a lot strong straining during childbirth. So these are the factors: chronic straining, aging, genetic predisposition, and intra-abdominal pressure. Now, it's a very common problem due to dietic deficiency. People come with constipation because of dietic state. This is one of the area where lifestyle disorders, people who are sitting long term, having less of water, less of fibrous food, and having junk food, create a sort of sluggishness in the whole intestinal system. And that is why constipation comes up, and loss of sleep also. Loss of sleep, stress, irregular diet, all these are the causes for uh, constipation, and this chronic constipation causes straining leading to hemorrhoids. This is one of the reasons, very common reason that is found for formation of piles. Now, what are the symptoms of hemorrhoids? There is mostly bleeding during bowel movements because of the staining. The blood vessel gets engorged and then bleeds very profusely. There is anal itching, irritation, pain and discomfort in the anal area, protrusion of the tissue from the anus, especially during or after bowel movements. So the first symptom is some sort of irritation, some sort of itching, and then you get a pain and discomfort. Many a times there is swelling inside the anal area where there can be an internal hemorrhoid or an external hemorrhoids. So there are two types, external and internal. But in mostly these cases of hemorrhoids, bleeding is a major factor, pain is a major factor. Here you have to differentiate with fissures as well as fistula. In fistula, you have a discharge which is mostly bloody as well as it is accompanied with pus, and there is lot of odor. While in fissure, pain is more severe rather than bleeding. So clinically, you have to differentiate between fissure and piles. Once you know that is more of hemorrhoids or piles, then you have internal as well external. In internal also there are various grades of hemorrhoids. Grade 1 is they bleed but they do not prolapse, they do not protrude. In grade 2, there is prolapse or staining, but it reduces spontaneously, it goes inside on its own. In grade 3, there is prolapse on straining and require manual reduction. We have to push. As the patient says, we can understand the grades of the situation. And grade 4 is spontaneous, irreducible prolapse. So this is grade 4 internal hemorrhoids where they come out and then many a times it is felt as bunch of grapes or you can feel the bunch. Now, what are the clinical symptoms mostly that are seen are rectal bleeding, itching and irritation, protrusion during bowel movement, and feeling of incomplete evacuation, unsatisfactory sensation for after stool. There is no satisfaction. So these are the common complaints that a person is having with hemorrhoids, with internal hemorrhoids or maybe external hemorrhoids. Mainly Because of that, they have flatulence, they have GIT disturbances, they have irritations, but the main cause is mostly constipation. This constipation can also come from torpid liver. If the liver is becoming torpid, that also can cause constipation. One more symptom that is mostly seen is sluggishness of the intestine. The movement, the bowel movements, the intestine becomes very sluggish. This is how, if you see our rubric constipation, we have constipation due to sluggishness, inactivity of rectum. Inactivity, there is inactivity. And there is, though there is activity, there is not passing of stool. So inactivity of rectum also has to be taken care when there is sluggishness of the intestines, which are seen in many cases of constipation. While in external hemorrhoids, you have a clear visible lump, pain or discomfort, swelling around area, and tenderness to touch. Now, in these cases, one must do a clinical examination. This is a must. We as homeopaths also must do external examination as well as physical general examination. In general examination, you will have to see his blood pressure, his nails, because if you are confirming some remedies, you have to see the nails, you have to see all the general examination to be done. And then if you can do investigation or local investigation, there you have to see digital examination, proctoscopy, or C for FOBD. Then if you need, then you can assessment of the whole external hemorrhoid situation can be done very well due to our examination by self. Internal examination is visualization of the anal, canal, and rectum using a proctoscope or an endoscope to identify internal or external hemorrhoids. It needs a little bit of recurrent, what I can say is examinations. If you start doing recurrent examinations by your own self, you will learn, you will understand how an internal examination is to be done. Though it is many times painful, so you have to be very much cautious during doing internal examinations. But if you learn that, I think you can grade yourself very well, and then you can understand what is really happening with the patient. And many a times, these local symptoms can help you to give you an immediate acute remedy. Just seeing that can also give you an understanding of what I have to do immediately. So there are two things. One is an immediate medication that is to be given immediately so that the pain is relieved. The most important part in management of piles is the pain and the bleeding. They are more disturbed by pain and bleeding. And we have very good remedies that can relieve the pain very fast, as well as the bleeding can stop very fast. So, keeping our eye on what is the present scenario of the patient, we have to see our remedy coming up. And in the then you have to have, one is the remedial management and the other is the conservative management. First, we will see the conservative management and then we will go to remedial management. So in conservative management, what we have to see, we have to relieve the constipation. So increase the fluid intake, high fiber diet. If the body weight, obesity is one of the cause for constipation, and the causes of staining has to be avoided. Then if they are having a sedentary lifestyle, they should go for some exercises or yoga. So this type of lifestyle situation, their food situation, loss of sleep, irregular timing of food. Many a times they don't eat regularly, and they, in India specifically, in our country, is drinking lot of tea. Rather than eating food, they drink a lot of tea. So drinking lot of tea is one of the cause which can cause to acidity, constipation. Tobacco, chewing tobacco is one more thing. Many people say that without they take tobacco in the morning, they can't pass stool. Tobacco is one of the reasons. So all these things are to be taken into consideration. And if you can understand what is the basic causative factor for creating constipation, constipation in turn creates piles. So try to resolve constipation, and then we can see that you can really help the patient. But there are two things, as I said, acute as well as chronic. The chronic is the constitutional treatment, the acute is just to give relief immediately. So we in our clinic have seen various cases of various age groups. From age group 10 to 20, we had total 115 cases. In the age group of 10 to 12, we had 4 cases. In the age group of 21 to 40, we had 73 cases. In the age group of 41 to 60, we had 42 cases. This is the biggest age group that we saw. And from 61 to 80, we had only 2 cases. So these were the cases that we had. If you see symptom-wise distribution, pain during defecation and bleeding per rectum total were 60, pain during defecation were 30, pruritus ani were 5, anal discharge were 8, prolapsed piles were 5, soiling were 2, and swelling of the anal situation were 5 cases. So these are the distribution of the cases that I had. So if you see case first, a 40-year-old woman came for a recurring issue with piles. She had been experiencing piles since last 1 year. Pain was occurring once every 2 to 3 months. However, in the past 15 days, the pain has been constant. She described the pain as throbbing and mentioned that is worse during and after bowel movements, and it lasts for 1 to 2 hours before reducing on its own. The patient has not sought any treatment for piles so far. She also complained about persistent fullness in the abdomen for the past 1 year. The fullness tends to be worsened from evening till night and does not subside even after burping or passing of gas. The patient has been experiencing headaches for a year, occurring in the frontal and occipital region. The pain is relieved only when she is occupied and applies pain balm. So these are the symptoms we took for analysis, and repertorization were done. Fat desire, tea, overuse, as I said, dreams of snakes, sleeplessness, fullness sensation, pain forehead, stool hard during, pain burning, stool hard. And we came to the understanding of so many remedies. Sulfur, Naxwamica, silica, Natramur, pulsatilla. But here in the generals, as in this case, what happened? She was suffering from chronic long period of time. But when the pain became more persistent last 15 days and bleeding was more, there was intermittent bleeding which was going on. She had become anemic also. This is why the general examination is important. She had become very anemic, and because of her anemia, we gave her China offensive 200, 12 doses per week, and Ferromet 60 3 times a day. Whenever, due to bleeding, you have anemia coming up very strongly, and that also gives rise to abdominal bloating, fullness of abdomen. And it was here overuse of tea also, and that is why we went to China and Ferromet. And if you can see in the follow-up, after 15 days, the pain had decreased and she need not need to come back for pain. But we continued Ferromet for some period of time so that the anemia can be covered well. So, though in this case, there was piles, there was pain, but the overall constitutional situation made us to think of more of China rather than any acute remedy, maybe retinia or maybe peonia. Case number two, a 33-year-old homemaker visited with complaints of piles persisting for last 10 years, especially intensified over the. One more thing here is people, especially in India, don't relieve these complaints unless and until they become really worse. They are suffering since long, but they feel that it is part and parcel of what they are having, and they continue with the same. Similarly, here, this lady was having complaints last 10 years, but last 2 months, when they become more worse, then she started feeling that she should take some medication. She described her symptoms as having hard stools, necessitating straining during bowel movements, leading to bleeding and a burning sensation. The pain persists throughout the day and worsens when sitting. The patient came in pain, so a detailed history was not taken initially because the pain was more. Medication was prescribed based on modalities and physical generals. So, what was the remedy given? We gave her lycopodium 200 3 times a day for 5 days with her evening aggravation, burning, fullness, and the symptomatology that we got here. Pain, the peculiar symptom for lycopodium was stool hard followed by soft stool is one of the thing, and better by warm application. So we gave an acute remedy, lycopodium, for 5 days, and then we called her again further. Follow-up on January, only 10% relief in pain and bleeding. The pain was throbbing and burning aggravated during stool and sitting. Now we took all other menstrual history and family history. Something very much peculiar came in the family history, or important came up in the family history. Mother had breast cancer, father and parental uncle has diabetes with hypertension. So, taking this family history into consideration, we gave her the basic remedy, carcinosin. Carcinosin, this is peonia, carcinosin 200, 3 times a day for 1 day, and then peonia for 5 days. So here carcinosin was interpolated uh, because of the strong family history. And this is where the individualized or the whole symptomatology of the patient, the past history, the family history comes into play. And carcinosin did the trick. Peonia was given SOS for pain. Now here it is a third case. A 40-year-old man presented with a history of chronic hemorrhoid. His occupation involved prolonged periods of sitting and irregular time of food, habits of tobacco, chewing, and alcohol consumption exacerbated the condition. The patient reported discomfort, pain, and occasionally bleeding associated with pain. The patient's symptoms included throbbing pain and burning sensation during the bowel movements. Here, Plantago major 30 was given frequency with 4 times a day for a week. Now, in this case, he was a tobacco chewer and an alcohol consumption. So, due to his tobacco chewing, he had a lot of pain in the tooth, and that concomitant of tooth pain along with the pile situation made us to think of Plantago. Here, the toothache became as a very strong concomitant symptom, and Plantago did the trick, making him totally better in pain as well as in bleeding. So, if you see the follow-up after Plantago, the patient reported a noticeable improvement in the symptoms. The throbbing pain and burning sensation reduced, and there was a significant decrease in the swelling. The remedy proved effective in providing relief, especially considering the occupational aggravation as well as the concomitant symptom. Thus, it is important in homeopathy that a concomitant situation or a peculiar situation or a peculiar symptom during that phase or his lifestyle disorder can give us a clue or a hint to what should be our remedy or to differentiate one remedy for the another. Now, if you see the differential table for hemorrhoids, you will see that Aesculus, now these are all local remedies. Aesculus hypocastinum is blind, not bleeding, purple in color. Key sensation is burning, fullness as if sticks in rectum. It has also been differentiated with pyonia. Modalities is worse standing and walking. Constitutional keynotes is venous status and sedentary lifestyle. In LOs, you have protruding grape-like piles. They are external hemorrhoids, burning, sore, aching sensation, weak, worse by heat, better by cold application, laxity in the splinters, and the stool may pass involuntarily. That is one of the strong fear or involuntary sensation, as if the stool can pass, and it many a times pass also. Patient says that he wants to pass flatus and stool come out. That is one of the good positive symptom of LO, where you can give LO without any difficulty. Hemomelis is bleeding piles, sore bruise, aching sensation, worse by motion. It's more of a passive venous bleeding and a lot of weakness. So here the concomitant in hemomelis is you can see some varicose veins on the body also, on the lower limbs, especially it is post-delivery. Many times you see post-delivery lot of varicose veins coming up. And if varicose veins are there accompanied by this type of situation, hemomelis can be a very good remedy. In peonia, you have ulcerated fissured piles. There is ulceration, there is lot of pain, and there is lot of bleeding also, burning, itching, better by cold application, and worse during stool, sensitive, offensive discharges. The discharges are offensive here. Pain as if there is a lot of stick in the rectum. This is what the patient says is a peculiar symptom of peonia. Muriatic acid is bluish protruding. Piles are bluish protruding. Smarting and burning pain. Worse during school. Profound debility with involuntary stool. As it is an acid, debility is more marked in these cases of muriatic acid. Marked debility as well as stool also is many times involuntary because of the weakness. They are unable to find that the stool has passed. So muriatic acid comes, he is just lying in bed, he can hardly speak. That type of weakness, it should be seen in muriatic acid. Nakswamika is the best remedy, and I think 80 to 90% of the total cases require sulfur and Nakswamika, because it takes care of more of the lifestyle sedentary habits, irregular dietic habits, loss of sleep. These are the major three things that we see: loss of sleep, irregular diet, loss of water, and lot of mental exertion with lifestyle disorders. So Nakswamika becomes a major remedy. Mostly 80% of our cases of piles, especially piles, can be helped with Nakswamika and sulfur. These are the two remedies that can be used very easily and you can get immediate results. So blind piles with constipation, constant urging and painful, uh, worse morning after stool, irritable, sedentary, business minded. So this becomes a very hallmark for Naxwamika. Sulfur, there is a lot of congestion, inflammation, burning heat sensation, worse by heat and standing, heat intolerance, standing and thinker. Aggravation by heat is a hallmark for sulfur, and he is a burner. So there is a lot of burning, burning in anus, burning in abdomen, burning of the eyes, burning of the palm soles. He says that a lot of heat sensation is felt everywhere in the body. Whenever this is the situation, hunger aggravation, desire for fat, aversion to sour, whenever you see such situations, then you have to think of sulfur. Though Nakshamika also has desire for fat and desire for spices. So sulfur and Nakshamika are a good combination for mostly 80% of cases of piles where immediate relief can be sought in the pain as well as in the bleeding. So you don't have to need to take much of the history. Many a times when you see for acutes, if you are in a hurry or patient in a hurry, sulfur and Naxwamika can give you very good results. Next is capsicum. Swollen painful piles, intense burning, worse during stool, chilliness and sluggish reaction. So in capsicum, you also see the generalities that you have to take into consideration for capsicum. Ignatia, prolapse piles, sharp stitching pains, worse after stool, nervous, emotional, and hysterical. So, as we are talking that it is more a constitutional situation many a times. So, in Ignatia, you will have this nervous, emotional feeling where when Ignatia comes up, Natramur is a good follower, Natramur or Sepia. So, whenever this layer of emotional setback or emotional disturbances come up, the patient may go to Ignatia, Natramur, or Sepia. So you have to be very uh, vigilant in understanding what is the real disturbance that is causing the whole GI tract disturbances. Pulsatilla, she is mild, bleeding, bluish, raw, sore feeling, worse by heat, better by open air, mind changing, changeable, yielding. In mind, it is a mild lady, yielding and changeable. The important hallmarks of pulsatilla. Now, pulsatilla is very useful for post sapien pulsatilla. Can be used in PCOD cases, irregular menstruation, lot of OC pills taking, and post delivery also. Pulsatilla works with kali carb. Kali carb is the first remedy for piles post delivery. Post delivery, whenever a lady comes with severe pain or bleeding, there may be backache or there not may be backache, but mostly you have a backache. So if you have a backache, kali carb is confirmed. If there is no backache also, it's bleeding, and but the cause is post delivery, kali carb is the first remedy. Then you can change your remedy to other, but kali carb becomes the first remedy post delivery bleeding piles. Now, important signs and symptoms, if you see blind piles where you don't know what is happening inside, is aesculus. Aesculus also has a very strong concomitant of backache. Naxwamika. Bleeding piles is hemimelish. Bluish piles is muriatic acid and pulsatilla. Protruding gape like is Ehlers. Better by cold is Paeonia. In Ehlers, one more thing is the protrusion. The rectum protrudes. There is prolapse of the rectum. So in grade 2 or grade 3, up to grade 2, Ehlers can be very good useful in grade 4, many a times it becomes very useful that aloe can be really help you out. Better by cold is peonia, standing aggravates is esculus and sulfur, and intense burning during school is capsicum. So you know in capsicum, there is a lot of burning all over the body. The capsicum has a very strong burning situation. Now, if you see bedside quick reference is venous weakness plus bleeding hemamelis, constipation plus ineffectual urging is naxwamika, needs to go again and again for stool. There is unsatisfactory sensation. Ulceration and fissure is peonia. One more remedy for ulceration, if you have very strong ulcers or ulcer formation around the rectum, is nitric acid. And what is the importance of nitric acid is it has desire for fat, desire for salt. The discharges are very offensive, especially the urine, and in the mind, the patient is very irritable. Highly irritability is seen. The irritability mostly seen in the morning when the patient wakes up. If somebody says good morning, he says forget it or don't do any good morning. So that morning irritability after waking up, along with this situation of desire fat, desire salt, offensive discharges, and an ulceration. Maybe he also having recurrent mouth ulcers. Nitric acid becomes a very good remedy. So this is a quick bedside reference for the patients of piles or hemorrhoids. In general, if I want to convey that this is one of the area where homeopathy can be a very good boon and surgeries can be avoided. Post-surgery also, because it is more a constitutional disturbance. Post-surgery also, if the constipation persists, the piles come back again and the patient suffers again with the same scenario of hemorrhoids. So we have to treat the cause. Change in the lifestyle is important. Sitz bath also is an important phenomenon to be advised to the patient of piles. Now, what is sitz bath? In a warm water, you have to put some a very few granules of potassium permanganate, and they should sit in that warm water, lukewarm water, which is quite okay for their body. And sitting in warm water with potassium permanganate granules for some period of time gives a good anti microbial effect in the anal area. It cleans out, and the heat also gives rise to good amount of cleaning and new good amount of arterial supply. So sitz bath also plays a very good role uh, with these cases of piles. So in general, if you see a very good area for homeopaths where you can give good results, effective results, long-lasting results, and fast results. Second is no relapses. So what I feel is homeopathy in general is a science where overall 60 to 80% of cases can be well tackled with homeopathy without any difficulty, even in acute rush time or OPD times, or people who are doing general practice. Many homeopaths do general practice of allopathy. They can also work because in general practice, the crux of the patient is mostly acid peptic disease, heartburn, acidity, constipation, piles, fissure, fistula, acute respiratory, upper respiratory or lower respiratory tract infections, fevers. This is the major crux of the patients in general practice. So as this area of acidity and constipation, piles or fissure or fistula can be very well treated with homeopathy. So our students, especially the new generation, should not falter that what we are seeing today, the students are going away from homeopathy rather than practicing homeopathy. They are not having that confidence in homeopathy. These are the areas where they can work very efficiently, very strongly, and very perfectly. So, from this platform of IIHP, I would tell all our upcoming students or even the general practitioners not to run away from the pathy that they are already having in hand to work with our patients and rather change over to some other system of medicines. They should have faith in themselves. They should have faith in homeopathy. And if they strongly work with homeopathy, I think results are assured and homeopathy will never make them feel down. Homeopathy will not make them feel down whenever they are working very strongly with their own system of medicines. I once again thank all my IHP members, IHP platform for giving me this platform to share my views. Now, if any questions, I'll be there to answer your questions. Thank you very much.
Thank you, Dr. Hiralal sir. We are obliged and thankful to you from on behalf of IIHP Scientific Committee. I remember one of my case, one of my student, he was having very severe piles, but he one day he took a leave and I asked him that why you are on leave. So he said, nothing, sir, nothing, sir, nothing, sir. So he usually says, my problem is that I feel embarrassed when I ask you for going to urine. It was in BHMS third year. Okay, why you feel embarrassed? He said that I cannot tell in front of whole class that I feel embarrassed. And especially when I pass urine, my piles come out. And he was so embarrassed that he said, I am suffering for almost 10 years, but I have never told this problem to anyone. So when I saw that protruding piles while passing urine, the Brita carb was the remedy. And Brighter Carb helped him so much that due to that embarrassment of being laughed at, that if I ask for passing urine or if I ask for permission to go to urine, other what the girls of my class or other colleagues would do, they might laugh at me. So Brighter's sensitivity of being laughed at and protrusion while passing urine, these two symptoms led me to the Brighter Carb, and that brighter cup helped a lot. And in my practice also, I have seen many cases of piles getting cured and post surgical cases. And another thing I would like to emphasize here would be that sometime while taking case we forget that suppression of piles is one of the rubric in generalities. Suppression of piles can lead to many major, even autoimmune disorders. I have seen one case of that RA factor. Every nothing, no mind, nothing available. Only history available was that she got operated upon for piles, and after that she developed that rheumatoid arthritis. So that sometime is an area where sometimes we overlook. We keep on treating it, and suddenly patient said, "I'm okay now of piles." Sometimes even with our prescriptions, that happens. So suppression of piles. So these rubrics: suppression of eruptions, suppression of piles, suppression of sweat, suppression of emotions. These suppressions, when they lead to another disease, this is a very important physical journal, and you should also uh, consider this very important factor while prescribing for the remedy. So thank you, sir, and thank you, Dr. Shwani, both. And I would like to invite questions from the audience. We have 10 minutes of time left for the question answer. Then we'll conclude, and I would invite dignitaries to um, for the vote of thank. If there is a question, you can raise your hand or you can just unmute yourself. I'll allow. Anyone having any question regarding files or today's presentations, both the presentations?
Uh, Thank you, Dr. Hiralal ji. Myself, Dr. Sanjeev Agarwal. I had a uh, uh, I had seen a news regarding hemorrhoids due to use of mobile in washrooms. So
Oh
that
dear.
may cause 40% increase in the cases of hemorrhoids. Perhaps this is increasing nowadays. We have to consider this one also.
Yes,
That
Dr.
is the
Sanjeev, you are right.
precipitating factor.
Yes, Dr. Hirala, your take, sir.
Thank you.
Uh, Thank you, Dr. Sanjeev, sir. I have not come across, but I would definitely, we have to be very much now cautious because increased use of mobiles constantly has created a lot of ripple in the health issues. So I have not come across anything now, but I have to be now vigilant to find out situations. But if you have some experiences about some cases regarding use of mobile phones and hemorrhoids and any
Yes,
remedy
sir.
helping will
I
give
think
us
what he
more
has,
better.
Dr. Respected Dr. Agarwal has emphasized that people has a habit of using mobile phone while sitting on the toilet seat for the
Toilet
longer time.
also. Right,
Yes,
right.
so he has emphasized, and I agree to that, that this prolonged sitting, because while using mobile, you are not aware of the time. So sometimes you sit so prolonged and you call it is a constipation, and some people have that private time also. So it might precipitate. And another thing is, we all know that Naxwamika and those are the remedies where sedentary habits lead to the
Naxwamika
yeah, the
can,
cause
now we can
of
discuss. Naxwamika can be a good remedy because finally using mobile or it's again using the brain. Maybe you are using your workload. Many people are working. If you are seeing these IT
And
people, they are
Naxwamika
really
has that
working.
prolonged urging also, that person is sitting
Yes,
for longer time because he
yes.
might feel be repeated urges. Uh, Dr. Agarwal, we are open for discussion. You can unmute yourself and participate. I would like.
Thank you, sir. Thank you. You have explained everything. Thank you.
Yes, any more experiences about the piles, and we are open for the discussion. Anyone else? Dr. Tanveer, would you like to add something? Are you there?
Tanvir sir is there.
Hello.
Hanji.
I have any very good. First of all, I would say
Tanvir
thank you
Saab,
to
namaste.
Namaskar, Namaskar Hiralal ji. I was enjoying the presentations from both the presenters today, and I congratulate both of them. One of the experience which I have learned from Dr. L.M. Khan Sahab is once he rang me up and told me one important information regarding this piles and all. He told me that after suppression of piles, as just Dr. Muktinder Singh has said, if you find any problem of stomach complaints, am I audible to everyone?
Yes, yes, yes.
Yeah. If patient has come to you after suppression of piles and after that he got any complaint of stomach region, then the only medicine is crocus and the
Yes,
source
yes,
is
yes, you
fatak.
are audible.
The
Okay.
source is fatak materia medica,
Repertory.
and repertory, yes. So it is very good medicine for this. So rest of things were all fine. One question to Dr. Shivani, I think from Bhartesh College from Belgaum.
Yes, sir.
Dr. Shivani, your presentation was fantastic. I have done my third PG from Belgaum AMC Medical College, only from Belgaum. So I did my BHMS
Yes,
from
sir.
Maulana Azad Medical College, Hubli. You told me that in the first case, you prescribe pulsative medicine for the acute complaints of the patient, and after that, you gave this
Yes, sir.
constitutional medicine to the patient. What was that medicine? I was unable to understand. In
Oh,
the first case of your
constitutional
fever,
data I didn't mention in this.
yeah.
Yes, yes.
So what was the
So
medicine? Second
I
medicine?
highlighted the acute cases. Second
No, I want
medicine is constitutional was calcarea phos.
calcarea phos.
No, chronic details I didn't mention over here, but his constitutional was calcarea phos.
Okay.
Usually, like I practice that when an acute comes, just to prevent a relapse or something, it is followed by a constitutional remedy after all the symptoms get subsided of an acute episode.
Not only constitutional remedy. Yes, you are right in a way, but Dr. Haniman says when after treating any acute case, you have to give him some anti-psoriatic indicated medicine to prevent the relapse. So that's why I wanted to
Yes, sir.
know what was that medicine which you have prescribed to the patient.
Yes, sir.
Anyways, thank you very much for both of the presentations. Thank you very much. Thank you.
Thank you, sir. I have a case of hemorrhoids, internal hemorrhoids. During my early practice, one of the patient complained of sudden appearance of a mass near the anal region. So he didn't had a major constipation as such, but in the history it is there like he used to use phone while defecation. So usually when they use phone, the stages of defecation gets hampered. So no symptoms, like there's no pain, no burning, no bleeding, nothing. It just appeared suddenly. So I took help of repertory, and there was one rubric, hemorrhoids appeared suddenly. So there's only one remedy, that is muriatic acid. So muriatic acid helped in that case. The mass got regressed. That was
Mhm.
the experience. There's only one
Good.
remedy, suddenly appeared.
Mhm. Good.
Thank you, sir.
Yes, Dr. Hiralal sir, you can stop the presentation. So
Yeah.
we'll be heading towards the conclusions. So now I would like to invite our President, Dr. Sivamurthy sir, to say a few words.
Sir, good evening, sir. Good evening, all the participants here. First of all, my hearty congratulations to our scientific committee chairman, Dr. Muktinder Singh, sir, for starting this webinar series in a grand manner. And our immediate past president, Dr. Tanveer Hussain, sir, Dr. Chairperson, Women's Cell Chairperson, Dr. Geeta Mangia ji, and my national colleagues and all the participants. So, first of all, congratulations to our speakers, Dr. Sivani Reddy and Dr. Hiralal, for wonderful presentation. But the participants are first 24, now it became 19. So we have to increase the participants in future. So even though we are doing these WhatsApp postings, all those things, but the participants are becoming less. From next month onwards, we are also introducing the student membership. We are introducing free student membership. For those students also, we are inviting this webinar so that we can add more participants and we can enlighten their knowledge also. So this is the next within 1 or 2 days we are going to inaugurate this student membership and for free membership. So we are adding our participants more for this webinars also. So once again, thank you very much, sir, Dr. Muktinder Singh, sir, for continuing for starting this webinar series and all the participants. Our Dr. Tanveer Hussain sir, Dr. Geeta Mungia madam, and Sanjeev Agarwal, and all participants. And thank you very much for giving me this opportunity. Thank you, sir.
Thank you, Mr. President.
Thank you, sir. Thank
Now
you
I
very
would
much. Thank you
now I
very
would
much.
invite our Women's Cell Chairperson, Dr. Geeta Mungiar, for the vote of thanks. Ma'am, please. Unmute कर लो आप.
No. Thank you, sir. Thank you, everyone. Thank you, Dr. Hiralal sir. आपका बहुत अच्छा रहा प्रेजेंटेशन. मैं तो रास्ते में सुनते सुनते आई. और डॉक्टर शिवानी का भी बहुत अच्छा प्रेजेंटेशन है. और सबको ज्वाइन करने के लिए बहुत बहुत ही अच्छा थैंक्स. डॉक्टर मुक्तिंदर सिंह का ये बड़ा अच्छा वो है साइंटिफिक चेयरपर्सन के उस पे कि ऐसे ही कंटिन्यू रहेगा ना, लोगों को पता लगता रहेगा कि ये सेशन होना है, इस टाइम में एक रेगुलरिटी रह जाएगी तो बढ़ते जाएंगे. जैसे डॉक्टर शिवामूर्ति ने बोला कि और बढ़ेंगे, तो वो हमें रेगुलर उस पे करेंगे तभी रहेगा. उनको याद के इस समय ये सीएमए वेबिनार होना है और हमें अटेंड करना, ये हो जाता है. ओके, थैंक यू एवरीवन.
Thank you, everyone, for this beautiful presence. Thanks again, Dr. Hiralal sir. Thank you. Now we close the meeting and meet next month. Thank you.
Thank you very much, sir.